Did you know that every 2 seconds, someone in the world is diagnosed with diabetes? It's a startling fact that underscores the widespread prevalence of this condition. But before we dive deeper, let's take a moment to understand what we're up against. Diabetes is a chronic, long-lasting health condition that affects how your body turns food into energy. Your body breaks down most of the food you eat into sugar, glucose, and releases it into your bloodstream. When your blood sugar goes up, it signals your pancreas to release insulin. Insulin acts like a key to let the blood sugar into your body's cells for use as energy. However, in diabetes, this system goes awry. The body either doesn't make enough insulin or it can't use the insulin it does make properly. As a result, glucose builds up in the blood instead of being used by the cells. Over time, this high blood sugar can lead to serious health issues, including heart disease, kidney damage, and vision loss. And it's not just about too much sugar in the blood. When cells can't get the glucose they need, they starve for energy. This can lead to fatigue, hunger, and weight loss, even though there's plenty of glucose available. In essence, diabetes disrupts the body's energy supply, which can have far-reaching effects on our health. It's a complex condition with many moving parts, but understanding how it affects blood sugar regulation is a crucial first step. While diabetes is a single term, it actually encompasses a few different conditions. Each type of diabetes has its own unique triggers and symptoms, but all share the common thread of high blood sugar levels, which, if not managed, can lead to serious health complications. Let's start with type 1 diabetes. This is an autoimmune condition, which means the body's immune system mistakenly attacks and destroys the insulin-producing beta cells in the pancreas. As a result, people with type 1 diabetes produce little to no insulin, the hormone responsible for transporting glucose into cells for energy. Approximately 5 to 10% of the people who have diabetes have type 1. If you have type 1 diabetes, you'll need to take insulin every day to survive. Currently, no one knows how to prevent type 1 diabetes. Symptoms can come on quickly and may include excessive thirst, frequent urination, unexplained weight loss, blurred vision, and fatigue. While type 1 is typically diagnosed in childhood or adolescence, it can develop at any age. Next, we have type 2 diabetes, the most common form of the disease. Unlike type 1, type 2 diabetes occurs when the body doesn't make enough insulin or don't respond to it properly. This results in glucose building up in the bloodstream instead of being used for energy. About 90–95% of people with diabetes have type 2. Risk factors for type 2 diabetes include obesity, physical inactivity, and a family history of the disease. Type 2 diabetes can be prevented or delayed with healthy lifestyle changes such as losing weight, eating healthy food, and being active. Symptoms are similar to type 1 but can also include slow-healing sores and frequent infections. Gestational diabetes only occurs during pregnancy. Hormonal changes during pregnancy can make a woman's body less responsive to insulin, leading to high blood sugar levels. Gestational diabetes can increase the risk of complications during pregnancy and delivery, and may also increase the risk of type 2 diabetes later in life. Symptoms are often subtle and may be mistaken for normal pregnancy discomforts. Lastly, there is prediabetes. In prediabetes, blood sugar levels are higher than normal, but not high enough for a type 2 diabetes diagnosis. Prediabetes raises your risk for type 2 diabetes, heart disease, and stroke. If you have prediabetes, a healthy lifestyle change program can help you take healthy steps to reverse it. Despite their differences, all types of diabetes pose significant health risks if not properly managed. Thank you for watching. Please subscribe to our channel and like this video for more informative content.